Alcohol consumption impacts the mesolimbic dopamine system, which is the brain's reward pathway. Alcohol increases dopamine release in the nucleus accumbens. The surge of dopamine creates feelings of pleasure, relaxation, or euphoria. This reinforces the association between alcohol consumption and reward. Prolonged alcohol exposure reduces the brain's natural dopamine production over time. The brain adapts to artificially elevated dopamine levels by downregulating its own synthesis. Reduced natural dopamine production leads to a state where alcohol is needed to achieve a normal feeling. Diminished baseline dopamine levels create a dependence where alcohol is required to counteract the deficiency. Alcohol interacts with multiple neurotransmitters in the brain, influencing brain function. Alcohol increases GABA activity, leading to calming and sedative effects. Alcohol suppresses glutamate activity, slowing brain function and impairing memory. Alcohol triggers the release of endorphins, creating pleasure and reinforcing drinking behavior. Repeated alcohol consumption leads to the development of tolerance, necessitating increased amounts to achieve the original effects. The body adapts to the constant presence of alcohol, resulting in physical and psychological dependence. Abrupt cessation of alcohol intake causes brain hyperactivity due to the nervous system's compensatory mechanisms. Alcohol withdrawal can manifest as anxiety, tremors, excessive sweating, and, in severe cases, seizures. Genetics account for approximately 40–60% of the risk of alcohol addiction. Some individuals inherit differences in enzymes like ADH and ALDH, which affect alcohol breakdown. Genetic variations in dopamine receptors can increase susceptibility to addiction. Variations in ADH and ALDH enzymes affect the rate at which alcohol is metabolized. Inherited genetic differences can influence an individual's vulnerability to developing alcohol addiction. Psychological factors, such as using alcohol to cope with stress, contribute to addiction. Trauma, anxiety, or depression can be significant psychological contributors to alcohol addiction. Social reinforcement, including peer pressure, increases the likelihood of alcohol consumption. Cultural acceptance of alcohol consumption makes drinking more common. The brain learns to associate alcohol with stress relief or pleasure, strengthening the addiction loop. This learned association reinforces the addiction, creating a cycle of dependence. Chronic alcohol use damages the prefrontal cortex, impairing decision-making and self-control. Damage to the prefrontal cortex reduces willpower and increases impulsive drinking behavior. Memory and learning centers, particularly the hippocampus, are also affected by chronic alcohol use. Impairment of the hippocampus and other memory centers increases the likelihood of relapse. Alcohol-induced brain damage can lead to long-term cognitive deficits and behavioral changes. Understanding the specific brain regions affected by alcohol is crucial for developing effective treatment strategies.